So we're going to do a shoulder scan just on this lady Elizabeth, and we're going to check over the rotator cuff, the bursa, make sure that the joints are working well. So this is typical for a shoulder examination with ultrasound. Now have a look at the front of the joint where the skin is, the deltoid muscle, and this is the front of the bone with what's called the long head of the bicep. And the beauty of the ultrasound scan, it allows us to see how the tissues slide and glide past one another, and from there we can check to see if there are any changes to the tissues and any tissue damage. This is one part of the rotator cuff that pulls the arm in towards the front of the body. Another key tendon that can cause problems is the supraspinatus tendon. This is a supraspinatus tendon from here, and this is an important structure, this thin black line, which is known as the subacromial bursa. You can just see how the shoulder just gently moves underneath the deltoid muscle at that point. Same tendon, but this time in what we call a long axis, and we're looking to see the movement of the shoulder as it passes underneath the acromion process. So we can take the arm out into elevation and look for any impingement, signs of where the bursa is bunching up or the tendon is gathering, because not everything can pass underneath this bone. Again, from here, quite another common cause of irritation can be this joint, the acromioclavicular joint, known as the ACJ. And this one does have some changes to it, and there is a degree of enlargement of the joint capsule. But this is not painful when we test it clinically, so therefore we just observe it, but it doesn't necessarily mean this is a clear diagnosis. Finally, to check the back of the shoulder joint, this is where we look at the other tendon, known as the infraspinatus, and we can see the circular aspects of the humerus, and we can see how when we rotate the bone out, the tendon's still moving nicely, there's no signs of tears or any damage. We come across and we can see all the muscles, the posterior deltoid, the infraspinatus. So this is typically what we would do to form part of a shoulder examination and look to see if there's any major tissue damage or tissue inflammation.